Hey there, and welcome. So glad you're here. If you're going through IVF, you are absolutely in the right spot. We're going to talk about one of the biggest milestones today, the egg retrieval. All right, let's just jump right in. Look, we get it. The whole idea of an egg retrieval can sound, well, a little intimidating, right? So our whole goal here is to break it all down step by step so you can walk in feeling totally prepared and, confident. So first things first, what is egg retrieval? Honestly, it's such a key moment in any IVF cycle. It's kind of the big payoff for all that prep work you've been doing. This is where we collect the eggs to get them ready for the magic that happens next. Okay, so what does that actually mean in plain English? Well, it's a really short, minimally invasive procedure where your doctor gently collects the mature eggs from your ovaries. And these are the eggs that, fingers crossed, will be fertilized in the lab. Now, I know the word surgical procedure can sound a little scary, but I want you to know this is super routine, it's very safe, and it's a totally essential part of the process. Okay, let's move on to getting you ready for the retrieval, because honestly, what you do beforehand is a huge part of making sure everything goes smoothly on the big day. And it all comes down to this really critical 36-hour window. It's all about timing. So at a very specific time, usually about 34 to 36 hours before your procedure, you'll give yourself what's called the trigger shot. This is a hormone injection that is so important. It gives your eggs that final little nudge to mature. Getting the timing on this exactly right is key because it makes sure the eggs are perfectly ripe for collection, but, and this is crucial, before your body has a chance to release them on its own. All right, so for the day of, there are just a few simple things to keep in mind, and they're all about your comfort and safety. First up, you'll need to fast for a bit. No food or drink. That's just standard procedure anytime sedation is involved. Definitely wear your comfiest, loosest clothes. Think sweatpants. And this one is a non-negotiable. You have to have someone lined up to drive you home. The sedation will leave you sleepy, so you can't drive. And yeah, the little things like taking off jewelry and makeup, that's just standard clinic stuff to keep everything safe and simple. Okay, you've done all the prep work, and now it's time. Let's talk about what actually happens inside the procedure room. We're going to pull back the curtain, and I think you'll see it's way less intimidating than it might sound. It's actually a really smooth three-step process. First, an anesthesiologist will give you some IV sedation. This is just to make you feel super relaxed and drowsy, kind of like a nice nap, but you're not totally out. Then, your doctor will use a transvaginal ultrasound. That just gives them a perfect view of the follicles in your ovaries. You know, those little sacs where the eggs have been growing. And finally, using that ultrasound as a guide, they use a very, very thin needle to gently draw out the fluid from each follicle and, of course, the egg that's inside. And that's it. It's pretty amazing when you think about it. After all those weeks of prep, the actual procedure is usually over in like 15 to 30 minutes. Seriously, before you even know it, you'll be waking up and heading to the recovery area. All right, procedure's done. Now, the most important thing is you. We're shifting focus to your recovery. The name of the game here is just to rest up and be really kind to your body. So, what can you expect to feel? It's totally normal to have some mild cramping, kind of like period pains, maybe some bloating, and a little bit of spotting for a day or two. And you'll probably feel pretty tired from the sedation. So what's the best way to feel better? Simple. Just plan to take it easy for the whole day. Drink lots of fluids, and a heating pad is your best friend for any cramping. For pain, something like Tylenol is usually okay, but you'll want to check with your doctor before taking something like ibuprofen. Now, while recovery is usually super easy, it is so important to know what signs to look out for when you get home, just so you can be totally on top of things. And really, this is the most important piece of advice. Listen to your body. A little bit of discomfort, totally expected, but severe pain, that is not part of the normal process. If you feel anything like that, it's your signal to call your clinic right away. Don't ever hesitate. So let's get really specific about what those signs are. You're going to want to call your clinic if you have severe pain that's not getting better, or if it's getting worse, or if you have heavy bleeding. We're talking soaking a pad in an hour. A fever of 100.4 or higher is another one. And anything else that just feels off, like really bad nausea or shortness of breath. The bottom line is, trust your gut. It's always better to call. Some of those symptoms can be a sign of something called ovarian hyperstimulation syndrome, or OHSS for short. It's rare, but it's basically when your ovaries have a bit of an over-the-top reaction to the meds and get swollen. Your clinic is watching you like a hawk to prevent this, but it's still really good for you to know what it is. And really, that's what this is all about. Knowing what to expect is everything. When you understand the whole process, from that super important trigger shot to what recovery feels like, it just takes the fear out of it and replaces it with confidence. You've got this. You are totally prepared for this amazing step. Okay, and before we wrap up, just a quick reminder, please remember this explainer is for educational and informational purposes only and does not constitute medical advice. For any medical concerns, you should always consult with your doctor. If you're looking for more great resources on the whole in vitro fertilization process, you can find a ton of information over at ivf4me.com.